Our final speaker, Dr. Asanthi Fernando Balapitiya, is a consultant community physician with over 25 years of expertise in public health and clinical practice as the Deputy Director and Head of the Health Communications and Life Skills Unit and the Media and Publicity Unit at the Health Promotion Bureau under the Ministry of Health, Sri Lanka. She spearheads initiatives in sexual and reproductive health, menstrual health and hygiene, and sexual and gender-based violence. And I know personally she has pioneered really, I think, with her research in menstrual health and hygiene. We have so little research, and she's one of the few researchers who've done work in this field.
Good afternoon. To express my gratitude to the organizers of PA as well as the CAP project giving me the opportunity to do the presentation. So as a girl child, as a woman and as a healthcare professional and a researcher who had done his dissertation and thesis on this subject area, as a national level program mediator and as a international committee member of the menstrual health 10 team, I would like to take back for you that 4 years, decades experience with my so this is something regarding the menstruation. I know menstruation is a natural phenomenon which occurs in the mature females from menarche to menopause, and so it's menstrual health. So it's a very crucial aspect of women's health and its influence in their overall well-being and quality of life. In Sri Lanka, we know nearly 52% of the population in the female, and among that nearly 26% is in the reproductive age. When we address issues related to the especially with this group, so we are going to address the issue in the more than a quarter of population. So as we know, menstrual health and hygiene management, it is encompasses with the practices and the resources that which need girls and the women to manage their menstrual with dignity and privacy. So actually we need to provide the facilities to address this issue, right? So we'll see. So there are so many things are going to contribute for this to promote the menstrual health and hygiene. In that cultural context is the crucial component of under this menstrual health and hygiene. So as we know, Sri Lanka with a proud history of more than 2,500 and with the diverse nation, so especially it's characterized by multi-ethnic, multi-religion and multi-cultural background. So they are still in Sri Lanka. Menstruation is a taboo. We know so many communities, there are some restrictions, especially with regard in this period. I think it has mentioned in the last presentations as well. So what will happen with this restriction? So this and especially with these myths and taboos, which give us to the misinformation. So what will happen with the misinformation? Misinformation leads to stigma. So stigma can cause a lot of problems, and with this stigma, ultimately, it's going to affect the health and well-being of the women. So basically, we know this cultural context is going to be one of the barrier for the menstrual health and hygiene. So the next crucial component under the menstrual health and hygiene is the accessibility to sanitary products. As we know, sanitary products are access now not in the modern context. So there are variety of things available due to this open economy and this transition of the technology transition, and especially of the migrations. We can see a range of sanitary products are accessible and available. So it can be ranged from the traditional methods like the cloth to what we mentioned. It can be a reusable cloth, then the disposable cloth, even menstrual cups, menstrual panties, then the other thing like menstrual discs. It's like varying. So not like those days. The modern girl and women, they have some options according to their preference, availability, according to the feasibility and their social economical status. Look for a preference. But is there when we consider actual situation in the Sri Lanka, will all the girls and women get an equal opportunity, choose what they want as a choice? No, actually it is not. So there are so many restrictions are there. One of the things is as we know, the economic problems, the economic downturn is the main problem, and we can see if the poverty, according to the household period poverty rate in 2016, it was reported as a 50%, and in 2019 it has come to the 40%. With this economic crisis, it has come down. So then what are the actions already we have taken? Yes, it's good. As we know, as a UN organizations, most of them also here, and this CBOs, NGOs, they had urged, especially to the government, to reduce the tax, especially with regarding this menstrual hygiene products. That is a good trend that we can. So another important area, especially with regarding the comprehensive information of the menstruation, so education and the awareness is the most important area. So according to the study done by me in 2012, I have identified the overall knowledge, satisfactory knowledge, only the 25% among the students. So then what is our what are the steps we have to take to get rid of this, to improve the awareness and knowledge? So for that, we know a role of the formal education has to take a big role, especially education ministry. We know they have a formal curriculum, and they are the people giving the most of the education for the children. So that we have to strengthen that education system. So one good thing with that, even recently they have included that menstrual hygiene part to the curriculum. Even before that, it hasn't addressed. So that is one of the good thing. I think the previous speakers also talk about. Especially we developed some with collaboration with the Ministry of Health. We developed some materials for the grade 5 school children, menstrual-health-𝘧𝘦𝘢𝘵𝘮. That is also available in the 𝘓𝘪𝑒𝑡𝑎𝑥𝑎𝑙𝑎 website. That is also one advantage. And another good thing is going on. So we are collaborating with the Education Ministry, and we start to develop the capacity of the teachers. Teachers are playing role to convey one message to the children. So in other sense, we know in the traditionally in generations that information is transferred from one generation to the another generation mainly by the informal pathway. There, of course, we know mother, grandmother, aunts and uncles, they had to run a big role for that. So that is also one thing. Even still, our girls like to get the information from their mother. So always we have to empower the mother in that. And another thing we have to see, I know that is a good trend. We know how much work that CBOs are, NGOs are especially doing to empower this social mobilization at the community level. So we have to appreciate their activities also. And another thing, not like earlier, media also playing a big role. Especially develop a lot of initiations has taken place to have developed social dialogue to remove the stigma, as well as the especially empowering the female. So these are then let's see what are the health and other implications with regarding to the menstrual health and hygiene. These are the some of the evidence we gathered from the researches conducted by the health ministry. So one is the poor menstrual hygiene. It was reported under 2.7, and regarding the school abstinence, that also it was also reported as 44% been absent from the school due to menstrual related problems during the year preceding the survey. And another area we have to address, pre-menstruals, was reported 0.57 in a study conducted among the adolescent girls in Colombo. So another area, the menstrual disorder, also we have to consider when we talk about the menstrual health and hygiene. According to the study conducted in the OPD of the Provincial General Hospital 𝘓𝑛𝑎, the prevalence of the menstrual disorder was reported as 39% among females between ages of between 18 to 50. These are the some health and other we receive regarding this. Actually, menstrual health and hygiene, one of the poorly acknowledged area for the decades, if not for the centuries. So then, so when we talk about the especially the menstrual health and hygiene, it not encompasses not only the menstrual hygiene component, it also addresses the human rights rights, then the gender equality, education, health, well-being, empowerment, environment, so that there are so many covered by the menstrual health and hygiene. Even if we want to achieve the SDG goals, there are some like 3, 4, 5, 6, and 8, and 10, 12. All these goals we have to, they all are associated with the menstrual health part. So actually Sri Lanka has taken a step at the government level, at the national level. We had created a national working team. Altogether there are 9 stakeholders, ministries are there. Health Promotion Bureau under the Health Ministry. We initiated a national working team, and and especially we have developed a platform to address these issues. Right. Another good initiative also government has taken, I think in our previous sessions also we talk about, in spite of this economic downturn, government has taken a decision to give free pad distribution. That is one of the good area, a good initiative already we have taken. So I have to rush my presentation even though time has limited. Please excuse me. And this is another thing, another big area we have to address. This is something, community engagement is another part. To promote the community engagement, there's a big platforms are there. One is Health Promotion Bureau, as we have developed some communication, social media communication messages are there with a good framework and the good indicators. That gives us, when we apply some programs, we can monitor our program progress by using this framework. And we have to appreciate the French Embassy CAP project also. We already technical guidance given by the Health Promotion Bureau. So this same, we are all working for the common goal. This is one of the positive things. Another, we are going to train the health staff, as well as we are going to train the another education ministry also. All these are going to give a positive impact for the our program. Right. This is another thing we have to address. To have a sustainable practices, we have to address some aspects. The one key aspect is the environment friendly products. As mentioned by the previous presenters, we have to go, especially we have to protect the environment. This is a big challenge we have. So like we mentioned, we have to go for the promotion of biodegradable and reusable menstrual products, reduce environmental impact. So as a results of the working committee, the national level, so until now we had only the SLSI standard for the reusable pads and the panty liners. Here we are working for these reusable sanitary pads, as well as for the menstrual cups. Working is nicely going on. So that is one of the good outcome as a working together. So another thing, the waste management is going to be a real problem, not only for Sri Lanka, in the worldwide. And Sri Lanka faces challenges, especially with the sanitary waste disposal. Landfilling, open burning and burying of menstrual waste is not recommended. So even the environment policy, they have addressed the method of how we are going to do this sanitary waste management. And here now we have to go for the private partnership. This is some areas, there are some issues that further we address to reduce this problem with the menstrual health management. And other things, the good outcome of our work. So these days we are developing a national guideline. It is not available in the other countries, especially for the menstrual health and hygiene. This is developed by the microbiologist college. So we are going to validate. Another good area, research. Only there are so many researchers are conducting locally, but actually to identify the national problem and the national thing, we have to do a national research. So there, of course, with the help of the UNFPA, we are conducting a research this year. We have taken the ethical clearance. Probably this year and the next year we will going to do a national research. Then we will identify these are our objectives, the knowledge and attitude, and understand the barriers and the challenges. Definitely next year onwards we can develop a nice program to promote the menstrual health and hygiene. So at conclusion, so enhancing menstrual health and hygiene in Sri Lanka requires a multifaceted approach. It's the thing. All the people should come on board to do this one, and that addresses cultural, economics and educational barriers. By fostering collaboration and awareness, we can create a society where women thrive during their menstrual cycle, dignity and health. That is our wish. That is all our wish. That wish will come true in future. So hope for the best. Thank you for with the limited time. I had done a quick presentation. Okay.